is the hope that we're going to get to a point where we don't have to constantly worry about or obsess over COVID all the time?
I think so.
It's going to be like the flu, I think, at some point.
Right.
Yeah.
And we're not there yet, though.
Well, no.
I really still think that the best way we're going to get there is to get the rest of the world vaccinated, because that's where the variants are coming from. So I think that question really depends on how good a job we do as a global community in making sure that happens.
Obviously, many families were touched by this. They lost loved ones. There are those who have had COVID and are still feeling lasting effects, some of them long haulers, others who have lingering conditions and effects. But it's still impacting them. We are seeing folks that are still feeling the effects, even if they had COVID a year, 2 years ago.
Right.
We're still seeing those patients.
And that's an important, I think, to me, I'm not a pediatrician, I don't see children, but I think that's an important point too, is that long COVID does happen in children. And so people sometimes think, kids don't really get that sick from COVID. And for the most part, that's true, but kids can get long COVID. And that's something that I think the vaccine prevents. So again, I think even for the age group where it's approved 5 to 12, it's really important for parents to get their children vaccinated.
And Deborah, we talked that there aren't clinics being held now, but there is going to be a continued push in the spring and through the summer, really for kids. For now, it's for kids 5 and older, and so that age group, the 5 to 17, 18 school-age kids, there will be a real push to try to get them vaccinated.
There is a push every day to get everybody vaccinated.
Absolutely.
And that age group, the 5 to 11-year-olds, just remember too, they weren't approved to be vaccinated for many, many months. So they're lagging behind because of that as well. But we're always there to vaccinate. I don't know if the schools are going to want us to participate in more vaccine clinics come the spring or the fall. I think it depends on what we're seeing in the community as far as transmission.
One thing about the vaccines, I do think that I just want to make sure we don't give people the wrong impression of, I know that for the vast majority of people, we've used what's called messenger RNA vaccines, which are the Pfizer and the Moderna. And I think a lot of people had the one-shot J&J. And I just want to remind people that yes, J&J did have some problems with blood clots happening. We didn't see that around here, I think mostly because we didn't have that many people that got J&J. But I will say that because of the monitoring for vaccine safety, they came out and revised who got J&J, and now we have recommendations of who gets J&J, and basically the populations that were most likely to get those blood clots, we don't recommend they get that vaccine at all.
So they get the Pfizer or the Moderna.
Exactly. So, things did get adjusted for vaccines if there was a problem. But as far as the messenger RNA vaccines, which are the new kind of vaccines, there really has not been any big issue at all with these vaccines. In fact, I think it's going to be the new standard that vaccines are developed from, at least in the developed world. This will be the way vaccines in the future look.
Over the past 2 years, how difficult has this been for healthcare workers? We certainly heard the incredibly long hours, the stress. Has it taken a toll on healthcare providers, this pandemic? As
an infectious disease specialist, we've actually been, we have don't have near as much of the ICU care that or the day-to-day care that people get on the hospital floors. But I think that it's really taken a toll on the nursing staff who have had to work constantly hard and at times when were at risk to themselves, because we didn't early on know exactly how contagious it was. And I cannot thank them enough for their dedication that they put forward for what they've done. And but yes, it's been a really rough time for them. A lot of times their own families were sick and they were having to come, not necessarily from COVID, but they had to be there. It's been an incredible thing to see as far as I'm concerned about especially the nursing staff and the respiratory therapist and the everyone. I mean, it's really been an effort in our hospital. Housekeeping, same thing. Housekeeping is incredibly important for a hospital. And people never give them the credit they deserve. They're going into COVID rooms, cleaning COVID rooms before anybody knew how dangerous it really was. And they did it, and they were dedicated. So,
That was so
I think-
critical, sterilization of any
Yes.
place a COVID patient had been.
Exactly. And I think, as a doctor, I'll come in a room for 10 or 15 minutes. A nurse will be in patients, directly involved with the patient for 12 hours.
Yeah.
So, yes, but to get back to your question, I know it's taken a toll, but I think we've been luckier here than a lot of places because we were not overwhelmed like some places were.
And healthcare workers, obviously, with County Health Department working around the clock.
We were, especially when our numbers were so high, and we had a team doing I&Q, doing the case investigation and the quarantine and isolation, all the calls. So, for example, if you we might have had one patient called that came positive. So then we looked at we got names of their contacts, and for one person it might have been 10, 12, and if it was a school kid it might have been upwards of 30 contacts because of classrooms and bus and athletics. So we had a whole team, a room full of people that were just doing I&Q calls, not to mention then in December we started with the vaccinations and setting up all the clinics, and so we had to split the team up, and yeah, it was.
I don't know, honestly, I don't know how you guys did it. I still don't.
we were working through 7 days a week.
I believe it.
Yeah, just doing calls. We would do calls we'd get positive calls on Saturday morning for somebody, and we end up doing contact tracing and.
And I know for so many people, I know there's the COVID fatigue. I know it's been a long 2 years, but realistically, to develop a vaccine as quickly as it was developed, to get this percentage of the population vaccinated in a year, and to be where we are now, I think is probably will amaze a lot of people that we've been able to do what we've been able to do.
I think it's one of the things that's been forgotten, unfortunately, how incredible this was. This has never been done before in the history of the world, that's something that has been released this quickly. And again, regardless of your politics, keep in mind that the previous administration really is the one that was, I think, deserves the credit for getting these vaccines developed so incredibly fast. Operation Warp Speed, in my opinion, was an incredible success. And and regardless of what your politics are, it was the previous administration that made that happen. And so, again, I think I find it hard to really understand why some people are so hesitant to get a vaccine that seems to be based on their political leaning. It just doesn't make any sense to me because it has been so, and both sides of the aisle, it doesn't matter. The virus doesn't care what your politics are. And I thought it was a great thing that the previous administration did to get it this fast. It's never been done in the history of the world. So it's still, as an infectious disease doctor, I'm still amazed at how quickly this happened.
And Deborah, again, for folks that if they haven't had their vaccinations, the clinic is no longer up and running at Clinton Community College, but they can go right through the health department. They can set up an appointment there. You would encourage them. We'll put up your number, the contact number for them to reach out and set up getting a shot.
Actually, they can go on the Clinton County Health Department on the website, and there's a list of clinics, and the link is there that they can go to.